Hi everybody, my name is Swati Maan. I'm a dentist. Nowadays, I see people talking a lot about the youthful skin, youthful body. We talk a lot about the anti-aging products. In fact, we try a lot of anti-aging products, which is great because we all want to glow, we all want to look younger, and of course, we think that's better. But have we ever thought about the aging symptoms on our teeth? So let me tell you here the 5 major changes that happens on our teeth as we grow, or we can say as we age. Number one, sometimes the teeth starts to look shorter. That means we do not show as much amount of our teeth while smiling or talking as we used to do a few years ago. The reason is the worn down enamel. Number two, we start to seeing the teeth are not looking as white as they used to look before. That means they're getting more discolored or they're getting more stained. Number three, in many cases, we see that the teeth are getting more elongated. That means the gums are receding. Number four, the position of the teeth is not as straight as it used to be in the 20s and 30s. That is due to the migration in the teeth. And number five, the teeth do not feel that strong, and that affects our chewing pressure. So if you see yourself with any of these categories, it's good to talk more. So let's talk about all these factors one by one and the ways to prevent or get some treatment for it. The first factor was the worn down teeth. That means the teeth getting shorter and shorter with time, and we are seeing that our teeth are getting more chipped and hence getting more sensitive. So if you have this symptom, it's good to speak to your dentist about getting some veneers or crowns. You can have porcelain or the ceramic veneers and crowns, or you can talk about the composite veneers and crowns. Nowadays, there are some no prep veneers available as well, so do talk to your dentist about that. Well, this factor will be a bit expensive. This treatment will be a little bit expensive and it will subject to your general oral health. So just make sure that the dentist that you're seeing has got his expertise in cosmetic dentistry, because it's not just about restoring or regaining enamel, it's also about getting the whole makeover of your smile. Number two, if you feel that your teeth are getting more discolored, this is actually related to the first factor, because the more chipping or the more jaggedness happens in your enamel, it catches more stains of the tea, coffee, smoking, etc. and hence they start to look more discolored. Second thing is, if we are losing enamel, we are also showing the second layer of our tooth, which is called as a dentine more. That means, and the color of the dentine is dark yellow in color. So that means you're reflecting that color of dentine more because you do not have enough coverage on your teeth in the form of enamel. So if you feel that the teeth are getting more discolored, and if you don't want to go for any crowns or veneer work, then of course you can go for a regular cleaning. In one of my videos, I mentioned that the ideal time to visit your dentist for scale and polish or cleaning is 6 to 12 months. But in this scenario, I would say go and see your dentist for a scale and polish every 3 to 4 months instead of once or twice a year. Also, you can try some teeth whitening products because they are really help in keeping your enamel more brighter and whiter, but do speak to your dentist about that. Do not try the products over the counter. Number three was the gum recession. That means the gums are receding and now the roots of your teeth are getting more exposed and the teeth are looking more elongated. Well, this factor is slightly tricky to handle because the problem with gum recession, in many cases, it's irreversible. So speak to your dentist about the pinhole surgery, which is a way to regain your enamel. The specialist gum surgeon called as a periodontist is the best person to talk about that. But also, you can get your teeth roots covered with some composite filling material just to blend in the color and just to give some strength to your teeth structure. Because if you have roots exposed in the old environment, you will see the roots catching more cavities and more discoloration compared to your overall tooth structure. So getting some fillings done on the root surface will be helpful here as well. Fourth factor was about the teeth not looking straight. That means they are looking more spaced, they are looking more crowded. If this is your main situation, then talk to your dentist about having some gentle form of cosmetic orthodontics in the form of Invisalign, 6-month smile treatments, clear braces. There are lots of things your dentist can offer you, but again, that will also subject to your overall oral health condition. Number fifth factor was wobbly teeth. That means you are building up some gum problem as an underlying main problem. So if that is the situation, do speak to your dentist about what you can do to regain the health of your gums, regain the health of your bony structure, and what can you do to prevent the loss of your teeth. because there is nothing better than having your and keeping your natural teeth. So yeah, these are the factors which I think are quite important. We cannot prevent aging. We cannot prevent, this is a part of our growth, but I think adding some grace to our growth, or having a graceful and a beautiful smile, is just, it just gives us an extra star. So yeah, this was all about the effect of aging on your oral health. If you have any questions, feel free to let me know. And yeah, I hope you liked the video, and now you'll see me in my next video. Thanks again for watching.